Morning all. I'll be dealing with the fundamentals of tooth preparation. So, the contents include introduction, history, definition of tooth preparation, objective of tooth preparation, factors affecting tooth preparation, classification of caries and non-caries tooth defects, simple, compound, and complex tooth preparation, and tooth preparation walls and angles, classification of tooth preparation, stages of tooth preparation. It includes initial tooth preparation stage, final tooth preparation stage, then additional concepts in tooth preparation, newer concepts of food preparation, minimally invasive methods of food preparation, conclusion, and references. So coming to the introduction, in the past, more restricted treatment was for caries, and the term cavity was used to describe a caries lesion that had progressed to the point that part of a tooth structure has been destroyed. Therefore, preparation of the remaining tooth structure to receive a restorative material was referred to as a cavity preparation. Currently, many indications for treatment are not related to caries destruction, and the preparation of tooth is no longer referred to as cavity preparation, but it is referred as a tooth preparation. Coming to the history, ancient people used primitive tricks, trephides, files, and other devices to prepare adequate cavities in the tooth. In early 17th century, hand-rotated instruments which had clockwise rotating tube were used to make round instrumental cavities in the decay. Hand drills with steel burr heads were used by twirling in the 19th century. Later, a burr, thimble, and bendable drills by attaching flexible shaft were used. Additional introduction of other mechanical devices was named as Lewis drill and Mary's drill, etc. So the first dental engine was introduced by Morrison, Dr. James B. Morrison, in the year 1871. This foot engine was the first practical manual operated engine to be used in the dentistry. With the advent of the engine, dental handpieces were constructed to assist the use of handmade steel drills. Coming to the definition of tooth preparation is a mechanical alteration of a defective, injured, or diseased tooth, such that placement of a restorative material reestablishes normal form, function, including aesthetic corrections where indicated. What are the objectives of tooth preparation? The objective of tooth preparation are to remove all defects and provide necessary protection to the pulp, extend the restoration as conservatively as possible, form the tooth preparation so that under the force of mastication, the tooth or the restoration will not fracture and the restoration will not be displaced, and allow for aesthetic and functional placement of the restorative material. These are the objectives of the tooth preparation. Then, coming to the factors affecting tooth preparation, there are different factors that affect the tooth preparation. First, general factors such as the pulpal and predominant status of the tooth and the occlusive relationship of the tooth. Second one, the dental anatomy of the tooth, that increase the direction of the enamel roots, the thickness of enamel or dentin, the position and size of the pulp or pulp chamber, the relationship of the tooth to its supporting tissues. So all this determines these are the factors affecting the tooth preparation. And the next part will be the patient factor. Patient's age, aesthetic consideration, economic status, and patient high risk cases. So according to these patient factors, we have to decide our treatment plan. Which material is just restorative material, all these things should be planned according to the patient factors. And then the affected and infected dentin, the thickness of affected and infected dentin, and the restorative material factors. Certain restorative materials will be allergic to some people. Such things we have to consider during the cavity preparation itself. So, classification of caries, Mountain Hue caries classification system. It divided into sites and size. Okay, so in that site 1, it includes bitter fissures, site 2, the proximal surface, and site 3, the cervical contour of the tooth. And the sizes, according to the site, the different sizes of the cavity were classified. Size 0 to 4. Size 0 is the earliest lesion that can be identified as the initial stage of demineralization. Size 1, minimal surface cavitation with involvement of dentine. And size 2, moderate involvement of dentine. Size 3, the lesion is enlarged to beyond moderate. And size 4 is the extensive caries or bulk loss of the tooth structure. This is the GJ Mount classification of caries. So from that table, you can see site and size in XY axis. Okay, no cavity, minimal cavity, moderate, enlarged, and extensive. According to the 0, 1, 2, 3, 4. Then several non-carious tooth defects are there, like hydration, abrasion, erosion, and effraction. All this will be discussed in detail. And we can classify it into simple, compound, and complex tooth preparation, where only one tooth surface is involved, that is called a simple cavity, and two surfaces are involved, that is called a compound cavity, and three or more surfaces are involved, that is called a complex cavity. And now we are going to the tooth preparation walls. We can classify into internal walls and external walls. The prepared surface that does not extend to the external tooth surface are called internal wall. And external walls, prepared surface that extend to the external tooth surface, such a wall takes the name of the tooth structure. That's the external wall. Then pulpal floor, the internal wall perpendicular to the long axis of the tooth or occlusal of the pulp. That is called the pulpal floor. And the axial wall is the internal wall parallel to the long axis of the tooth. Pulpal wall is perpendicular and axial wall will be parallel to the long axis of the tooth. And angles. There are mainly two angles, line angles and point angles. Line angle is the junction of two planar surfaces of different orientation along a line. And point angle is the junction of three planar surfaces of different orientation. Then cavo surface angle. Cavo surface angle means it is an angle. You can see here it is an angle formed by the internal surface and the external surface of the cavity rotation. That is called the cavo surface angle. And the margin, you can see here, this is the cavo surface margin, and this will be the cavo surface angle. This will be the cavo surface angle. So it will be different for different respirating materials, such as for amalgam, it will be 90 degrees. It's called a butt joint. So for composite rod, we give a bevel from the cavo surface margin. Coming to the enamel margin strength, whenever we prepare a cavity, our enamel margin should have sound enamel rows. Okay, it should rest on sound denting. So enamel rows buttressed on the preparation side progressively, shorter rows whose outer ends have been cut off, whose inner ends are in sound denting. Because enamel rods usually have perpendicular enamel surface, the strongest enamel margin results in a cavo surface angle greater than 90 degrees. The classification of tooth preparation, it depends on the area involved and the treatment presented by Black. This classification designated as class 1, 2, 3, 4, and 5, since original classification additional class has been added in class 6. So in this you can see classifications of the occlusal surface, class 2 on the proximal surface of posterior teeth, class 3 on the proximal surface of anterior teeth without involving the incisal angle, class 4 proximal surface including the incisal edge, class 5 on the cervical caries, and class 6 incisal on the occlusal tip of the tooth. So next will be the steps in tooth preparation. You can broadly classify the steps in tooth preparation as initial tooth preparation and final tooth preparation stage. In the initial tooth preparation, there are 4 steps outlined: form an initial depth, primary resistance form, primary retention form, and convenience form. In the final tooth preparation stage, there are removal of any remaining infected dentine or respiratory material, then pulp protection if indicated, then secondary resistance and retention form, and the last step will be procedure for finishing external walls. So I'll be telling in detail about these stages of preparation in the next class. Thank you.